Hello, everyone. Welcome to the session titled From Spark to Scale, People Who Build FEM's Impact. How does an idea grow into an organization improving mental health across countries? In this session, Christina Thorsheim shares family empowerment media journey, built through the dedication of people who stepped up to help. She highlights several individuals whose contributions shaped FEM's strategy and impact. Attendees will leave with examples of how people found their path to contribution, how you can start yours today. Christina Thorsheim co-founded and leads FEM's mission to deliver cost-free, evidence-based impact at scale. Before founding FEM, she co-founded a VR health tech startup. Christina studied at the Norwegian University of Science and Technology and at Harvard Kennedy School. As a reminder, if you have any questions for the speaker, you can submit them via the Swapcard app. I'll be selecting a mix of your questions and some of the prepared questions during our Q&A. With all that out of the way, please join me in welcoming Christina Thorsheim to the stage.
Amazing. Thank you so much for that introduction, Sebastian. I'm really excited to be here. Let's see. Really excited to be here and really excited to be speaking to all of you. I've heard we have a very diverse group of people in this conference, which is amazing. And the goal of this conference is to help people across the world to take actions for different EA cost areas. So in this talk, I'm going to tell you a little bit about FEM and the work that we're doing. But I'm also going to focus on some of the individuals who have really made major contributions to our impact. And I think they serve as great role models. So if you're wanting to take action for impact, then you might want to consider some of the paths that these people have taken. So first about FEM, we make family planning radio campaigns that improve health and save lives. Annually, 74 million women experience unintended pregnancies. This leads to thousands of maternal deaths and millions of unsafe abortions. Across sub-Saharan Africa, 1 in 40 women die of pregnancy-related complications. Access to contraception is not enough. Stigma is also an important barrier. In Sokoto, Nigeria, a third of pregnant women and mothers said that using contraception would cause social backlash. Misinformation also prevents access. In sub-Saharan Africa, 28% of women with an unmet need of family planning report that fear of sterility or health problems is their main reason for not using family planning. And finally, lack of knowledge is also a concern. In 2018, a study in Kano, Nigeria found that nearly half lack knowledge of effective contraception. Radio remains an important source of information for millions across LMICs. Across 8 sub-Saharan African countries in 2019, 62% of people reported listening daily. But radio campaigns may focus on irrelevant concerns, feel disconnected, or air too infrequently. But some campaigns do work. A study from Burkina Faso found that a campaign, high-intensity campaign, increased contraceptive uptake by 20%. For campaigns to work, they need to be relevant, they need to actually speak to the audience and address their specific concerns. They need to be localized and feature people from the communities that the audience is from, and they need to be frequent. At FEM, we produce campaigns with these qualities. They destigmatize contraception, reduce misinformation, and inform about options. We air a campaign 10 times a day with ads and 6 times a week with shows. So to tell you a little bit more about what the process looks like, we first start by selecting locations where we believe we can have an outsized impact. We then conduct formative research to understand the concerns and motivations of our listeners. We then produce interesting content that goes on air. And finally, we measure and evaluate our campaigns to make sure we're having the intended impact. We started out in Kano State in northern Nigeria, and To give you a bit of a sense of how this works, we do quite a lot of research to understand if, like, which locations will be most impactful. And locations that are impactful typically have high maternal mortality, family planning supply, supportive stakeholders, and an ability to air content at low cost. Airing costs typically differ a lot between different locations. In Kano, Nigeria, 1,000 women die per 100,000 live births. So it's very high maternal mortality location. Compare that to my home country of Norway, 3 women die of every 100,000 live births. We've done multiple campaigns in Kano. One of them was a re-airing campaign where we reached around 7 million listeners for 9 months for just $63,000 of airtime costs. So it tells you a little bit about the cost component here. To create powerful campaigns, we do extensive formative research. Across 10 states in Nigeria, we have conducted research with over 3,000 people. We asked about the specific obstacles that people are meeting in meeting their reproductive goals, but we also try to understand who are the role models that people look up to, what people's lives are like at the day-to-day, which can really motivate stories and inspire our writers, and so forth. So we really pay a lot of attention and create content that resonates with our listeners. So to give you an example of an insight from Nigeria, we found that twice as many users compared to non-users believe that childbirth spacing was important for health. We also know from our research that people tend to trust health professionals in matters related to their health. So we created a Q&A show where we had a health professional talk about the importance of childbirth spacing for health. And finally, we work with local organizations to develop interesting and meaningful content. This is both nonfiction shows, such as the Q&A shows, but we also do storytelling shows, drama shows. We've done a serial drama. So there's a wide variety of content that is produced as a result of this research. And finally, we do monitoring and evaluation, which is very, very important to make sure that the material has been heard, resonated, and ultimately results in contraceptive uptake among the people who are looking to space children. So does it work? An external survey in Kano found that contraceptive uptake has risen by 75% since our work started in the States. Of course, with a pre-post campaign or data like this, it's really hard to entangle the attribution of various actors that are working in this space. We see this as promising, but we're doing a randomized controlled trial to better understand our contribution to this impact, which is going to be across 10 states in Nigeria. Since our pilot, we worked with 2 more local partners in Nigeria, airing content for 1 to 2 weeks in 10 more states. We expanded beyond Nigeria, conducting proof of concepts in Niger, DRC, Benin, and now Togo, reaching 35 million listeners with short and long campaigns. By 2030, we aim to reach 75 million listeners. This impact is only possible through the actions of a lot of people. And I want to highlight a couple of them, and hopefully you can see yourself in at least one of the people that I'm sharing about. But they're by no means the only people who have made this impact possible. So to start out, Leah Bolt did her thesis together with FEM many years ago. She actually took part in the effective thesis project, and she joined FEM after she was done with her degree, where she took over the management of our programs in Nigeria, and she quickly became our director of programs. She's then become our director of strategy and is a leader within the organization. So I'm putting her out because I think one really impactful way you can contribute to early stage organizations is to join as a team member early on. I think a lot of organizations might find it hard in the beginning to hire high talent, and it really makes a huge difference who the early people in the organizations are. So Leah's really amazing and has done so much for FEM across the organization. I also think effective thesis might be a good way to explore an organization and see if you might be a good fit for it. Yeah. So the second person I want to point out is Dr. Mansur Chakur. We connected with him because he'd previously been in touch with another organization working in northern Nigeria, and we talked about the mission that FEM had. Mansur has a ton of experience in family planning in Nigeria and a lot of knowledge about how to work with the government and how to best operate given the context in Kano. And he was very excited about our mission and also very generous with his time and support early on. And we still work with Mansur to date. So he's really been part of this journey since the very beginning. So if you found yourself in one of the countries that young organizations might be looking to do work, you might have know-how, connections, or advice that could be super valuable for these organizations. So, so that might be one avenue of impact you could consider. Sorry. The third person I want to point out is Eric Mofas. He has been doing a lot of incredible work in Norway and beyond in supporting effective giving and also working across other EA cost areas. He supported FEM in the early days, both with advice, but also with fundraising, and he's now one of our board members. So some of the audience today might not want to be doing direct work, but are still really motivated to create an impact. And there's still great ways that you can contribute. So often young organizations are bottlenecked by fundraising, and by supporting this, you might be able to have an outsized impact. Apologies. So the final person I want to talk about is Rowan Len. He's also one of our early employees at FEM and done an amazing job. And he actually first joined FEM as an intern when we had an intern program. And we ended up hiring him as our operations manager. After working with FEM for some years, he joined the C incubation program, and he's now started Respira Health, which delivers mobile-based rehabilitation programs for patients with respiratory diseases. So I think he is an amazing example as well, because the actions that you take today for impact can also affect the actions available to you later. So I think he's a great example. Thank you so much. Ready to go for questions.
Thank you so much for that incredible talk, Anna Christina. We have a few questions. We only have a little bit of time, so maybe we'll be able to go through 2 or 3 questions. But the first thing that I want to talk about is we at Effective Altruism love a good story. And that's an overarching theme that I've seen over and over again. So what I want to ask is, now that you have conducted research in multiple countries, what are you seeing in common threads in stories of the people that you work with, both within the information that you have collected, but especially within the information constraints that you have faced throughout this entire project?
Yeah, there's been a surprising number of similarities across the countries that we've done research. Very often we see that people are concerned about side effects, particular sterility, but also fear of bleeding. What does that mean? And obviously some of the side effects does happen, right? And some of them don't. So it's actually a pretty interesting and important question of how do you communicate accurately to make sure that you I apologize, that you address concerns and do that in a way that keeps the nuance. But that's a really important one. Stigma is another important barrier that we see across different locations as well.
All right, all right. And how was it for FEM to start work in new countries beyond Nigeria, considering all these challenges that you faced in communicating effectively, in making sure that you're being local as well, right? So a campaign that worked in Nigeria might not work somewhere else.
Yeah, so the way that FEM enters new locations is we do something called a proof of concept. And what this means is that we do a small project together with the local organizations where we learn a lot about the location. We also get experience working with a local partner. And this helps highlight a lot of important considerations in entering the new country. And then we have a pretty clear playbook of this is how our programs work. This is the way we do fermented research, the way we do production, and so forth. So even though the content is different and what we target and the people we're reaching, the stakeholders we're working with, I think we now have a playbook which is pretty robust to those differences.
Right. All right. All right. Your presentation also focused a lot on the feedback that you received, right? And doing a lot of self-assessment to make sure that the programs that you were implementing actually worked, which I loved. So my final question for you before we wrapped up is, how did failure influence the growth and the impact that you had as an organization as you were growing?
I love this question. I think that when you're starting something new, the unknowns that you have are just vast. There's so many different ways that you might be wrong about, what the solutions needs to be effective. You might be wrong about the type of people that you need in the organization. So I think finding ways to like relate to failure and effectively learning and maybe even designing for failure in terms of figuring out what your uncertainties are and like testing those first so that if you're going to fail, you fail quickly, I think is
Mhm.
a super important thing in starting a new organization. So, yeah, I would say we learned a ton of different things along the way. And I think we've been fortunate in that we haven't had any like big failure. And I think a part of that is like deciding early, like a ton of experiments to make sure that while the stakes are low and you're spending less money, how can you learn as much as possible? So I suppose that's a recommendation if anyone is looking to start an organization as well.
That is an excellent note to end on. Thank you so much, Anna Christina, for your time. And thank you so much to our audience for tuning in. This has been very, very insightful. And we hope you enjoy the rest of the conference. Thank you all so much.